Hi guys, welcome back to G Chats with your host G. We are, as always, in the G spot. I'm super excited for today's episode because it's a very beautiful one. It's a very nice one. I wanted to make this very lighthearted and empowering and happy and choose a topic that was really good and really inspiring because today's episode is going to be episode 30, which will conclude season 1 of G Chats. So I need to take a little bit of a break. A lot of amazing and big things are happening with the business, and I just kind of need to pause on the podcast. And that's exactly what this is, just a pause, take a little bit of a break, and then come back for a season 2. I absolutely love doing the podcast, but I just need a little bit of a break. I said that last episode, so I don't want to keep this too long. And this video is not long. I have 9 incredible women that I want to share with you guys. They are from the past, from modern day, present times, researchers, doctors, femtech trailblazers, all groups of women who have made huge advancements in reproductive health, in the female reproductive health space, in femtech, all of these different areas that is really inspiring. They are pioneers. They're incredible. And I just felt like giving short biographies of who they are and what they did and how it's been so impactful to female reproductive health is the most beautiful way to end off the season. Just showing love to these women and highlighting them. I just think it's super important. And I have been the last couple of episodes, they're very serious. We're talking about either conditions or we're talking about Black women's health disparities, which can be heavy. So I wanted this to end on season 1 to end on a really positive note. So yeah, these are categorized into, I believe I have 3 different categories. Yes, so I have pioneers whose work was either stolen or overlooked. Then I have modern day trailblazers in reproductive research. And then I have women of color who are changing the game. So we're going to be starting off with pioneers whose work was stolen or overlooked. And the first person we have is Dr. Mary Putnam Jacoby. Excuse me if I say any of these names incorrectly. I am doing my best to pronounce each and every one of their names properly. But Mary Putnam Jacoby was a physician and researcher who dismantled the false belief that menstruation weakened women's brains. In the 19th century, men used this pseudoscience to argue women shouldn't attend school or to work. Jacoby published an award-winning data that showed no correlation between menstruation and cognitive ability, which paved the way for women's participation in medicine, in schooling, in the workforce. And her evidence-based rebuttal was groundbreaking, but her name is rarely mentioned in medical history. And I'll be honest, I don't even think I was taught about Dr. Jacoby, at all. I don't think I learned about her. And it's a shame because there is this narrative that women can't work, go to school, they're too emotional, or too irrational, they have female hysteria, blah, blah, blah. All the things about our menstrual cycle and our uterus, altering our brain chemistry and making us sick and not capable of functioning in society. And challenging that was just so important, so empowering, so necessary. So she was definitely a pioneer in challenging these patriarchal narratives and patriarchal system. Number 2, we have Dr. Esther Sternberg. So while not entirely erased, Dr. Sternberg's early research on the immune system's connection to the brain was often overlooked in male-dominated academic spaces. She explored how stress impacts inflammation and hormonal cycles, which is now work that is foundational to understanding the immune reproductive axis. It's something even with my brand that I'm very keen on, understanding how the immune system impacts our hormones, impacts our reproductive system. And her kind of drawing that connection is, to think of my connection and me pushing this forward, to think of like somebody back in 1945 was also pushing this, is just really beautiful to think about. And despite institutional resistance, her work influenced how we view autoimmune disorders, many of which disproportionately affect women. Number 3, we have Dr. Helen Rodriguez Trias, and she is a Puerto Rican physician and activist. And she was a fierce advocate for reproductive justice. She exposed and fought against the forced sterilization of Puerto Rican women and Black women in the United States, and worked on expanding healthcare access for underserved communities. Despite her monumental influence on ethical standards in reproductive medicine, her legacy is often overshadowed by white male counterparts in public health. But I think that this is amazing because during the eugenics era and even during like the birth control being kind of like pushed and stuff like that, there was a lot of like testing that was done. I mean, historically, a lot of testing has been done on Black women, and even with birth control and forced sterilization, specifically to the Puerto Rican women in the United States and the Black women. It's really nice to know that there was a physician who was standing against this and was an activist. We need more of those. Physicians' works shouldn't just stop at seeing a patient. It should really be advocating for patients politically as well. So I think that this is a beautiful thing that Dr. Helen Rodriguez Trias was doing for her patients and for her morals and ethical beliefs. So next up, we have modern day trailblazers in reproductive research. We have Dr. Linda Griffith, who's a biological engineer at MIT, and Dr. Griffith pioneered the use of an organ on a chip technology to study none other than endometriosis, which is a condition that affects 1 in 10 women, but is underfunded and poorly understood. And she used her own experience with endometriosis to push science forward when no one else would. And her work is now revolutionizing how we study chronic pelvic pain, infertility, and inflammation. And I just think that this is so important because I made like a TikTok video about endometriosis, and that video went insanely viral for a good reason, because endometriosis is so misunderstood. So I'm just so glad that I was able to make a video that was so informative to kind of like give people more accurate information, and to know that there's like modern day trailblazers who are working behind the scenes on technology, on medications, on testing and things like that to improve the way that we are diagnosing people, and also like treating people and explaining this and educating. It's just really important. Like, I feel like I'm working so closely to all of these trailblazers, even though like they don't know who I am. It's just such an honor to feel so close to them and know that I'm like pushing their missions on with my educational content. But next up, we have Dr. Susan Fisher, who's a leading placental biologist. And Dr. Fisher's work on trophoblast invasion, which is how the placenta attaches to the uterine lining, it has been foundational to understanding miscarriages, preeclampsia, and even fetal development. And she faced skepticism in the field that's obviously dominated by men, specifically male OBGYNs. But she persisted, and it helped establish that the placenta isn't just a passive organ, but a complex endocrine and immune regulator. And this is super important because I think for a really long time, pregnancy itself, and I think we see this with even how we explain like periods to young girls. It's just like, yeah, once a month you bleed, but it's never the full explanation on like what is a period. Like, what's the period 101, what's actually happening? I think pregnancy is the same thing, right? For a really long time, people did not know that your immune system is weakened when you are pregnant. And the reason your immune system is weakened is because your body recognizes the placenta as essentially like half of it is foreign because half of the DNA is from your partner. And so your body naturally wants to fight something in that capacity that's not yours, wants to fight it because it's a foreign object. But your body's immune system, your body recognizes like, oh, no, this is a pregnancy. We actually want to keep this. So we are going to lower the immune system so that we don't attack this. And it's like a crazy thing that our body does that I feel like naturally people don't know that. Like they don't know that. And so I find this work to be so fascinating, and to be a placental biologist is so cool. And that's why I tell people, like, whether you're a biomedical engineer, you become a microbiologist, a biologist, like, you can go into so many different areas of research. You are not confined to, like, oh, you're a biologist, you're going to do like environmental stuff or marine stuff or even just like basic level anatomy. Like, you can niche down into female reproductive health. So I love that this is an area of study. It's so important. It's so needed. And on that topic of female reproductive health, we have Ida Tin. And though she's not a researcher in the traditional sense, Ida works in femtech and has been groundbreaking. She actually is the person who coined the term femtech, and she created Clue, the app. And if you guys don't know what Clue is, it's an evidence-based period tracking app. So she is the founder. She created it, and her commitment to using data to advance menstrual health education has brought reproductive science into the hands of millions globally, because as I was just talking about, there's a lack of education with understanding periods, understanding pregnancy, and Clue has just been so helpful for that, and it's helping to normalize and validate female experiences. So she is such a trailblazer and such an amazing person. So I just knew like we had to highlight her in this video today. And next up, we have women of color who are changing the game. So first up, we have Dr. Nadine Burke-Harris, who is a pediatrician and public health advocate. And Dr. Burke-Harris uncovered how adverse childhood experiences, ACEs, including systemic racism, affect long-term hormonal, reproductive, and immune health. And her work shows how trauma can be biologically embedded, particularly in marginalized populations, reshaping how we understand reproductive outcomes in women of color. And I actually, if you guys have not watched my TikToks, you definitely should, because I did a video about Black women's health disparities in the United States. And I made a follow-up video because somebody was like, can you address the elephant in the room about like genetics, and why some people would just be like, well, Black people are the like inferior race and they are more prone to miscarriages and maternal death and things like that because they just have crappy genetics. And it's not the genetics in that sense. It is, and I talked about how socioeconomic status and the things, the environmental factors impact the body. It impacts the human body in a way that can cause health issues. And you think of, and I mean, I learned this in my 26 years of life, that when your nervous system even is put under constant stress for years and years and years, your body will respond to that through health issues. It just will. And Black people do experience this because of socioeconomic factors that are put on them, not because of the narrative that they're lazy, they don't work hard enough. There's systemic racism both in the economy and in society, but also in medicine. So it's affecting Black people twofold, like in two different ways, and it's impacting them because even though a large population of Black people are going to school, getting college degrees, as the bigots would say, like, oh, well, go to school, get a college degree, work up the ladder and stuff like that. Even when they are doing that, they're still facing racism in medicine when receiving care, especially in compared to white people without high school diplomas. So really socioeconomic status doesn't matter. However, we can't just blame poor genetics because in some cases, the genetics are a result of environmental factors. So I just love that Dr. Nadine Burke-Harris is calling this out because it is so freaking important, like so important. Next up, we have Jessica Yasmin Islam. And as a cancer epidemiologist, Dr. Islam's work focuses on disparities in HPV vaccination, cervical cancer, and STI screening among Latina, Black, and Asian women in the United States. She leads efforts to close racial gaps in preventative reproductive care, publishing heavily cited research on how systemic inequalities translate into deadly health outcomes for women of color, which, as we just talked about, similarly to Dr. Nadine Burke Harris, such an important topic, very much needs to be talked about, and I'm glad that more physicians are speaking on this. And last but certainly not least, we have Dr. Beverly Whipple, who's a neuroscientist and a co-discoverer of the G-spot as we're sitting in it. Dr. Whipple advanced our understanding of female sexual response, a field long dismissed as too emotional or irrelevant, and her work was often challenged, ridiculed, or co-opted by male colleagues, yet she persisted, advocating for female sexual health research to be seen as legitimate science and not taboo curiosity. And this is really important because I think when we think of like sexual health, it's just so taboo. Like, people look at sex and then think like, should health be associated with it? But sexual health is so important and something that needs to be discussed. So I'm so glad, again, physicians are talking about this, and we definitely need more physicians that are progressive and want to make a difference and not just stop their work at treating their patients, but going above and beyond to advocate for their patients and advocate for marginalized communities and advocate for change, because that's really how we make improvements. That's really how we start to reshape the way that people are receiving care and people are having access to care. So I just love that. I love that I can be a part of that, even if it's in a small way, like having a TikTok account, doing this podcast, and just like advocating for it. I'm so passionate about it, and I'm just really, really grateful that this is my niche. I cannot explain to you guys how passionate I am about this. Like, I care about it so much, and I'm just so glad that I found my niche, even though it was through my own reproductive health struggles. It was so worth it because I know that this is exactly what I'm supposed to be doing, because I actually enjoy having these tough discussions, because I want to see change happen. Like, change is so necessary, and I'm just grateful to be a part of it. And I'm so grateful to have you all here, whether you watch my podcast, you watch my TikToks, whatever the case may be. I'm just so grateful to have each and every one of you who are tuned in, who send me so much love, whether it's through a message, a DM, leaving a comment on my videos, or even just like buying my products. I love you guys so much. I'm so happy that you guys got to listen to this episode, and it was a happy episode for the last one of season 1. I will be back. If you are not joined have joined the email list on my website, please do that. To become a Meraki member, you will get all of the information about when we're relaunching season 2, or just like launching season 2. Subscribe to the YouTube channel so that you never miss an update, because we will update you guys when we are launching season 2. So yeah, just follow me on all of my socials, and I will definitely get back to you guys when we are launching season 2, which should be sometime this fall. But I need a little bit of a break. I'm so sad to take this small break, but I know that it's well needed, and bigger and better things are going to be coming, especially for season 2. So I love you guys so much, and I will see you guys next season. Bye, guys.